Hello, everybody. My name is Guillermo Garcia-Manero from MD Anderson Cancer Center in Houston. I'm very happy to be here today at the ASH meeting in San Diego, hosting this roundtable for blood cancers today with my colleagues from New Jersey, LA, and Miami. We're going to be discussing topics related to myelodysplastic syndrome.
Hi, I'm Jamie Koprivnikar. I'm from the John Theurer Cancer Center at Hackensack University Medical Center. It's a pleasure to be here today.
I'm George Yaghmour. I'm the Associate Director of the Transplant Program at USC Los Angeles. Genuinely honored to join you today for this discussion.
I'm Sangeetha Venugopal from the Sylvester Cancer Center, University of Miami.
We've been covering some of the key aspects of this data presented with Luspatercept at the meeting. I think maybe before we move to maybe the next part of this conversation, any updates or any data on real-world analysis with Luspatercept, maybe for George and maybe for Jamie? You know, at the end of the day, you were mentioning survival, but what about patient-related outcomes or, you know, any kind of patient-related data with this?
Quality of life data from real-world experience, also it's promising, and of course there is the data showed us like even quality of life based on a score, objectively and subjectively evaluated. It's an important point also. That's encouraging us in the setting of Luspatercept use in early or now moving from the Middle East to command and having access to start patient earlier on Luspatercept, improving just not the blood numbers and modulating the inflammatory status and giving them better quality of life. It's definitely encouraging for us to discuss with our patient.
Yeah, some of the real-world experience I thought was quite interesting. You know, we do know that the FDA kind of gave a broader label that, you know, it is a little bit easier now, at least in my experience, to get Luspatercept for patients who may require red blood cell transfusions. And so in the real-world abstract that was published, we did see that the majority of patients who were started on Luspatercept actually were not requiring transfusions. These patients, you know, again, this is sort of data from registries. It's not necessarily the most granular data in the world, but it did seem that these patients remained on the drug for a prolonged period of time without needing additional therapy for their MDS, well over a year, based on the abstract that was reported regarding the real-world use of Luspatercept.
That's wonderful. So it seems that we are replicating in the clinics what we did in those clinical trials, right?
Exactly.
So
Which is encouraging.
100%. So we are excited about this data.